The Newton Public Schools Medical Advisory Group put forth recommendations for routine COVID screening testing. The weekly testing would be for asymptomatic, unvaccinated, and vaccinated individuals. Here's more from a recent school committee meeting.
We've really deployed a multifaceted health and safety approach. And we've talked about this before. We've talked about vaccinations. We've talked about our health pillars. We've talked about ventilation. I think Liam might have a nugget or two to share with you in a moment about that too. But the bulk of our time tonight, we really want to talk about the testing program as one component of a larger effort to provide a safe educational environment for our students and our staff so that we can preserve as much in-person learning as possible.
The symptomatic testing is what we were doing last school year when that became available. And that is to do a point of care diagnostic antigen, rapid antigen test at school for anybody, students or staff, who become symptomatic during the school day. If they develop symptoms, we really want to do the test right then and there to know, are they positive right now? Because if they are, we certainly want to dismiss them, but also go about immediately doing the contact tracing to find the close contacts. If they're negative, we still dismiss them because they have symptoms, and then we ask them to do further diagnostic testing to make sure we know where they stand. So that's a continuation. It's the Abbott Binax now testing that we were doing last year. We will continue to do. It requires specific training for the nursing staff who will administer it. And we're busy getting more supplies and making sure that all of our staff, because we have some new ones, are up to date with the testing procedure. The test and stay model is new this year from the combined DESE, CIC, and endorsed by DPH. And this is really a program to find a way to keep our students who are identified as close contacts as a result of an exposure at school, to allow them to continue to come to school as long as they have no symptoms of COVID and abide by all of our pillars when they're in school. I feel good about this because what we know from last year is that we had so little in-school transmission of COVID, even though we had cases. We almost never, very rarely saw that case end up infecting somebody else at school. It's a controlled environment. We're following the rules. There's adult oversight. And so this is an opportunity for asymptomatic individuals who are close contacts, who are not otherwise exempt from quarantine and testing, meaning it didn't happen on a school bus where the windows were open and everybody was masked. It isn't somebody who is fully vaccinated. And it isn't somebody who is at between 3 and 6 feet from the positive individual while both parties were masked in a classroom setting. All of the other close contacts who don't fall into one of those categories, or I should add, recovered within the last 90 days of a COVID infection. Everybody else is eligible to do daily testing over a period of 7 days so that they get about 5 days of tests at school. And as long as they test negative, they can stay at school and continue with the in-person learning.
The daily test needs to be negative and they need to continue to have no symptoms. On this slide, there are 2 different bulleted approaches. We're using the second one, which means that people will collect 2 swabs on the day that they're being tested. One will be dropped into a pool of 10 samples, which the lab will then run. The second swab will be dropped into an individual tube, which will be labeled with the students' or staff members' names. If they turn out to be in a positive pool, the Broad Institute will go back to the second swab and test each person in that pool individually. So they won't have to do a repeat test in school. They will automatically, each person in the pool will be individually screened with the second swab, and the positive person will be identified in that manner.
We're undergoing our consent process. All consent for staff is in the CIC software, which is Crush the Curve, which is the same thing we used last fall. And that communication went out to all staff on Friday, the 3rd of September. And we currently have, as Liam checked right before we came this afternoon, and we have about 1,100 staff that have already consented to participate, which represents about 41% of our staff. And then the students their families will consent on their behalf through the Aspen Parent Portal, just like we did last time. And that went out this morning to families. And we have already today amassed almost 2,900 students consent, which represents about 23% of our student body, which is quite good for a single day. So, and then our Contractor Communications, like we did last time for our food service and for our aftercare. And this year we'll incorporate our bus drivers as well. We'll communicate through their supervisors, and then they will provide the individuals that they are assigning to Newton spaces. They'll provide them the ability to consent right in the CIC Crush the Curve software as well. And that's an ongoing thing. As far as a tentative timeline for rolling things out, we're looking at mid-September target. And our first group, our focus is on our most vulnerable students who are not yet eligible to be vaccinated. And that's our pre-K to grade 6 students and our and the middle and staff, grade 6 middle school students and staff, which is about encompasses 20 school buildings, about 6,100 students and 1,600 staff if everyone were to consent in. And then our second group will be the grades 9 through 12 plus with our students and staff. And that will in fact be all 23 locations, 1,200 students and 2,700 staff. And then once teams are established and the vaccination status is collected for all of our extracurriculars, athletics and theater and the like, then we can at that time roll out the testing program for that group. And then same thing with our contractors as we roll out, we'll get our additional staff members involved in the testing program.
Beth, I'm sorry, folks. I put in there middle school staff. This does include preschool staff, elementary staff, and middle school staff. So I apologize if it's not just middle school. So I just wanted to clarify that.
We always appreciate partnership of our school committee and our community at large, and all of those of you out there on TV land or Zooming in. We encourage, please, when you talk to people, please encourage folks to be vaccinated. Please follow health pillars when you're in our schools and things like that, and encourage participation in the testing program. The more participants we have, the more we have the tools to preserve in-person learning for all students, and the healthier our educational ecosystem is. You've heard us say that before. And when you're out and about and communicating with community partners about and your connections, please talk about the benefits of opting into testing so that our students can participate right in school and not have to worry about it anyplace else. Students that are not opted in cannot participate in Test to Stay because it requires parental permission, and they might have a situation where it might impact their in-person learning opportunities should they be determined to close contact and things like that. And we're doing everything we can to preserve against that because we don't want that to happen.